More than 16 million adults have experienced a major depressive episode in the past year, but only 30% respond by going to therapy or taking medicine.
And now researchers are finding ways to give patients hope of living a happier, more fulfilling life. News 9's Robin Marsh explains in today's Medical Minute.
Well, creating colorful artwork helps 69-year-old Christy Hart control some pretty dark thoughts that she's struggled with for most of her life.
I can remember my senior year of high school being extremely depressed.
At 40, the depression again became overwhelming.
I got Prozac, and it was like somebody took a paper bag off my head and the world existed outside.
Then in her 60s, health issues combined with the pandemic sent her spiraling again.
I didn't take pleasure in much anymore.
Already taking an antidepressant, Chrissy found out about the groundbreaking study at Washington University School of Medicine.
The worst news about it is we usually don't know in advance that someone's depression is going to be treatment resistant. We still, in this day and age, use a trial and error approach.
Psychiatrist Eric Lenz found that adding an antipsychotic medication actually can help.
The underlying idea is if you take two antidepressants from different classes, you may have a higher chance of getting better from depression.
The doctor says 30% of treatment-resistant patients finally found relief.
It was a pretty remarkable change really quickly.
Christy now uses another drug called bupropion along with Effexor and says it's actually changed her life.
Being happy is a nice thing, you know, more energy, less sleeping. People don't realize what depression does until you start to get help.
She definitely agrees with Dr. Lenz.
Just because it's been called treatment resistant doesn't mean give up hope.
The problem is particularly difficult in older adults because many have already been taking several medications for other conditions like high blood pressure, cardiac issues, maybe even diabetes. So switching to new antidepressants or adding other psychiatric drugs can be complicated because depression and anxiety in older adults may actually accelerate cognitive decline. For today's Medical Minute, I'm Robin Marsh.